Okay, this is a form that I'm hoping we'll only rarely have to use, um, and it's a release from medical responsibility form. I pulled this off one of the International Forensic Nurses sites. So essentially, I imagine that we may incur the need for this um, if we have someone who we really think through our medical screening um, may really need to be seen by a higher level provider at the ER, someone other than us, and we have tried through every way to persuade them to go, and they're refusing it. I'll be honest with you, this is something we're going to need to discuss more fully within our team. Um, but really, you should not do a same exam if you're sitting there with a patient that you believe is medically unstable. So should you try to get them to go to the ER? They decline. Should you call the ambulance? I would call the ambulance and have them decline transportation by the ambulance because the ambulance has a form. The ambulance personnel has a form that they will get the person to sign that shows that they are declining transport. Plus, it gives us another layer of protection should they choose not to be seen. But this is just a form to release us from medical responsibility. Um, just have them put the date of what's the date all this is going on, their name, their date of birth, to acknowledge that they are declining the following treatment. Make sure you have that filled out, and just a plain statement saying, I refuse this treatment against the advice of the same nurse. I acknowledge I've been informed of the risk involved and hereby release tech aspires, and any personnel associated with the program from all responsibility for any ill effects. Um, so we're just going to kind of do this as an extra documentation tool. I hope we never have to use it. I've sent some things to our university council who has responded back with, that's fine, use it. This is a form I've not sent him yet, but will this week to see if I can get any feedback on it. But it will be down there in the cabinet at least to kind of get us started should something happen in the first few days or until I hear back from him. So I just wanted you to be made aware that this is down there. Just as an extra thing, like I said, I did pull it from a well-respected resource, so that might give us some protection, but just have that down there for us just in case. Make sure you do have a patient signature and your signature as a witness on that.